All right, welcome back. It's Dr. Schiller continuing in part two of this discussion with Josh Goldberg, CBT practitioner who has done such great work with people around helping them recover from emotional trauma, difficult life experiences, and basically building skills and emotional intelligence to function more effectively as an adult to deal with illness, whether it be physical, mental, or both together. And so we're going to continue and talk a bit more. And some of the interesting topics we're going to get into this second half, including dealing with toxic shame and blame, how to deal with some of the physical manifestations of chronic emotional distress, and some of the sort of more physical, body-oriented approaches for dealing with these kinds of issues. So thanks for joining us, and here we go. I wanted to ask you about something else, Josh, and that is shame and blame and toxic shame. You know, it's something that comes up so often in the context in which I work with people around contemplative practice and spirituality and mindfulness and movement training and some of these other things where, you know, a lot of what we're doing is calming the biology and the physiology and helping a person find a place of calm, helping them move better, have less pain. And like I mentioned before, frequently what arises into that space is noticing how much constant self-blame and self-shame and even self-hatred that they might be experiencing. And I can imagine you've encountered that as well. And I'm wondering if you have any particular ways of thinking about shame and blame. And the reason I ask about that is because from my view, when a person is trying to take on new behaviors and grow and learn and develop a sense of self that isn't the victim, develop a sense of self that is taking action, that's proactive, that's taking responsibility, frequently that inner voice of like, I'm not good enough, I deserve this, this all happened to me, I'm worthless, whatever that self-blaming, shaming message is, can be so debilitating. So how do you work with people around that, if there's any particulars to that?
Yeah, that is a fantastic question. And I certainly want to just give a shout out to my wife to put on this because she actually taught me about this in terms of, you know, her inner critical voice and the outer critical voice, and just, I guess, teaching me about what's happening inside of a person when this is happening, like that. She calls it the inner critic, that is, you know, shaming the self and blaming the self, and then the outer critic, which is, you know, seeing people as being critical towards them.
Uh-huh.
And so I got all of my information and the whole roadmap from my wife. So without that, I mean, I wouldn't be even able to really to do anything with this, really, because it's really difficult, like you're saying, doctor, to try and, you know, to do this with someone where their own internal voice is saying to themselves that you're worthless, you're a, you know, piece of rubbish, or like, you know, you're despicable, it's your fault. And
Yeah.
this is a voice that, it's like a recording, the inner critic. My wife tells me it's like a recording. It doesn't have intelligence, it's just constantly speaking down to me.
Yeah.
And this is really the internal parent. I'm going to explain that. This is the internal parent talking down to the inner child.
Right. You meaning
And
the unhealthy, toxic internal parent?
yeah.
Yeah. Okay.
So now this is a recording, which, going back to that attachment phase, okay, the first, you know, say 6 years up to 8 years, whatever the child was experiencing, whatever the parents were saying to the child, you know, are you worthless, or can't you do anything, or
Right. Right.
just, and then the child then turning that in on themselves, like, obviously I can't do anything, maybe I'm worthless, it's
Right.
always my fault,
Yeah.
I'm despicable, I don't deserve to take up any space, okay, because
Yeah.
my parents always telling me to go away. So these voices are just a recording, they don't have any intelligence, and this is why it can be quite frustrating for the person that's suffering with this internal critic, and also someone trying to help them with it, because there's no proof of what they're saying, it's their inner child's experience. So
Right.
really the real foundation of the inner child reparenting work is to actually facilitating a communication between the adult self and the inner child self, because a child will tend to take on and to listen to the big person.
Yeah.
Because the big person is standing over them.
Yeah.
And, children have a natural awe towards the bigger people.
Yeah.
Because they're taller, they're bigger,
Right.
their voices are deeper, they're scary.
Right.
So the reparenting work is a person gives themselves, they give their own inner child a new recording through giving them these new messages. And
Right.
this is done only once there's, a significant amount of comfort, obviously, because an adult that is still anxious, an adult that is still seeing themselves as a victim, or they're not ready to look at things a different way, can't really reparent their inner child.
All right. So what I'm hearing, I just want to what I'm hearing is that there's a process of reparenting that you're teaching people.
Yes.
And the foundation of that is, first of all, reestablishing emotional intelligence so that the adult in real time, it has emotional awareness and understanding and has more compassion and forgiveness and these other qualities that are needed in order for them to speak to their child self that's inside of them. Is that
exactly? Exactly. And the client will actually do that completely in their own time and space. So I'm giving all of the credit to the people that actually, that undertake this work. In my opinion, they're truly heroic. And because when you have someone in front of you while you do it, it does take away from that, I guess the vulnerability to be able to go to those places. So I'm sitting.
I didn't hear what you said.
That the clients are actually doing this completely by themselves, obviously with my and my wife's support and guidance, but they're not doing it in our company. They're doing it in their own time and space.
Right.
So we set them up with the exercise. So I'm just saying, I give full credit, 100% of the credit to the very brave and heroic people that do this, because, they're the ones that are doing it for themselves. And that's what they're doing, is they're reparenting this internal child that's, I guess, missed out on a lot. And the experience that they had is, they weren't able to really process it. And they can actually give this inner child a new internal recording. So instead of the inner critic talking down on the self, they will take on the new recording, which is now what the adult self is giving the inner child. And this can take, a bit of time in itself, because it's a real relationship, that internal object of a person's inner child experience and their adult self. You can't just, communicate once or twice and that's it, I'm done. It's a relationship. You have to, most of the time the inner child, because of the experience that they had, they don't even want to be approached. So they can start out very cold. And then as they repeat the exercises, a lot of clients start to report that it gets a lot warmer. They start to feel that the inner child is starting to let go of a lot of things, and to really start to trust and accept what they're communicating to them in terms of the messages, and that voice now that's talking down to them, they're starting to take it on, and they're, I guess, letting go of that previous, that negative message that they put on themselves.
Right. So if I hear correctly, then at a certain point in your therapeutic relationship with the client, you'll recognize, okay, this person may be ready for that inner parent-child dialogue to heal those childhood wounds. And at that point, you'll give them certain exercises, and they'll basically take that and do it at home. You won't be doing it in the office with them.
No.
Interesting. And
no,
so you don't do it
by
in the
themselves
office at all. You're not like doing a guided, like, okay, meet that part inside of yourself that's feeling this or that. It's more like, okay, here are some principles, and you send them home with that, and they read it and they do it on their own, and journal or whatever. Or
yes, yeah, absolutely. And I'm not against that guided meditation part. In fact, I have a number of colleagues that do inner child work in more of a experiential type of guided meditation way. And because they have the therapist in the room with them, guiding them through the process, they can challenge the client and to get them to go to those places. Whereas our approach is just different. We give the person, I guess, full autonomy and everything that they need, and then they do it by themselves without our direct involvement. So they'll come back after doing the reparenting letters, and they will actually, sometimes they will, they'll always share the experiences with us.
Right.
But when it's actually happening, we're not present with them in person or over any type of Zoom call or anything like that. They're doing it by themselves. And every client, I guess, is responsible for their own inner child. So we're sending them away with the exercise, and we have clients that do it in the beach or on a park. I've even had a client that the only place that she felt comfortable to do it was in the hospital. So she went and sat in the hospital. She said to me, she's like, "Hey, Josh, is it weird to go and do this in the hospital?" I said, "Yeah, it's weird." But I said, if that's where you feel safe, go and be weird. Do it in the hospital. And that's where she did it.
The letter,
like writing. It's a writing exercise.
I see. And so it's like the same exercise over and over again, or there's different aspects to it. Could you say what it is, or is that a top secret thing? Or
no, it's not a top secret thing. It's just it's a exercise where, it's very similar to all inner child work. It's just a different way of I guess approaching it. So it's just the adult self, I guess, passing on messages to the inner child that was really left with this experience, and no one really came along and gave them the parenting that they really needed or deserved at the time.
So you give them certain messages that instruct them to give that message to their inner child, basically.
Yeah, and I get the client to come up with the messages mainly.
Okay.
Like I said, I'm doing very little.
How do you get them to come up with the messages? How does that work?
Well, you just simply ask the person, what did your inner child need to hear at that moment? And then, a lot of the times, because they've gone through that initial, I guess, training and past exercises, they're able to think about it and to really be connected and say, yeah, I needed to hear this and no one told me this. So the client is doing all of the work. It's, the only thing that's really being provided is just that process. And, even when I ask clients for testimonials after they've been through it, it's always a testimonial for the process. It's never like, oh, hey, can you write a thing to say how great I am? No, it's like, can you write about this process so that other people can see maybe the benefit in doing this type of thing? Because it's really the process and the client that is doing all the work. I'm just kind of like the tour guide that just hands out the maps,
Right. It's a great way to frame yourself. It's great.
Yeah. So the clients are really the ones that are doing all of the the good work.
So I wanted to just loop around to the beginning of that question, because we kind of went on a journey, right? If I heard correctly, my question was, okay, well, so what about self-blame and shame and toxic shame? How do you help people work with that? And if I understood correctly, the answer is, well, they do the inner child exercises. And at a certain point, you decide they're ready for that. And then through dialogue, you help them discover or reveal what are the messages the inner child needs to hear. And then depending on that, you'll give them the assignment to write letters to that inner child and give those messages.
Exactly. And when the adult self repeatedly communicates to this inner child that, you are viable, like you are wanted to take up space, like your emotions are important, and and also some valuable explanations also are super helpful for the inner child. Like, mom and dad were not emotionally available because of the trauma that they went through. Really just explaining things to the inner child that really weren't being told, like the inner child wasn't being informed of this at the time. So the child has to make up their own version of what happens, and they always turn it in on themselves. And so just coming along with these explanations and these kind of reassurances helps the child to let go of this feeling of shame. Like, I don't deserve to exist. I'm not safe. I'm in danger. So the person will communicate, you went through some difficulty. You're safe now. So it's really just communicating as if the adult self is really time traveling back into the environment and really just giving those messages that no one was really able to give that child at the time.
Yeah.
It's a very powerful exercise. And, the person is doing it autonomously. They're doing it themselves. I'm not really giving the person anything. They're doing it. They're reparenting their own inner child.
So tell me about your experience or your client's experience with that. I mean, on one level, this sounds, or it could be thought to be like a fairly mechanical thing. I'm giving messages to my inner child. It's sort of like, okay, it's an intellectual process. But, from my own perception and experience is that inner terrain, that inner child experience, there can be a lot of emotional pain there. And sometimes when those painful negative messages get contradicted by a compelling, convincing, more positive message that is really contradicting that false sense of self with a loving message, there can be a lot of emotional stuff that comes up for people that can be challenging, but also quite cathartic or therapeutic. Do you find that kind of thing happening with this sort of exercise or not so much?
Yes, 100%. So clients report back to us that they have huge emotional releases.
Uh-huh.
They have huge, overwhelming feelings of relief and I guess acceptance, peace, comfort, liberation, even redemption is a word that I hear from people a lot. Other people report to me that on other occasions when they do the letter, sometimes they just have like, I guess, more psychological healing, meaning that the child just learns new things and doesn't have so much emotional release, but just learns new things and just has a different kind of view on things now.
Right.
And so there's different, every time a person does this exercise, it's an experiential thing, so it'll be different. Even if they do the same letter multiple times, each time they do it, it'll be different.
Right.
Sometimes it's definitely more emotional than others, but every time a person does this, it is beneficial in some way, even if it doesn't seem like they're having huge, emotional, releases and breakdowns. Like that's something that I hear often. They come back like, "Oh, Josh, I did the letter once or twice and I didn't become emotional wreck." I'm like, "Well, that's okay. You don't have to. Like, it's not a prerequisite. Like it happens. It's experiential thing." So, and because of the preparation that the individual has done, the painful emotions that come up very quickly turn from discomfort into like relief. That's the main word that I hear is relief. Like, finally, I've been able to let go of this after holding it for so long. It's a very good feeling, and it can be exhausting and tiring. And occasionally, I have a client that will become nauseous. Sometimes, they can vomit. It's very rare, but they're doing it by themselves. So they're well informed that this type of thing could possibly happen. But it's like any healing, doctor, that, you go through short-term discomfort for an ongoing benefit. It's certainly worth it.
Right. Yeah. The healing crisis that can take a lot of different forms.
Yeah, absolutely.
So interesting. So you've already have done with them a tremendous amount of preparation to teach them to be present to difficult emotional states, to release of emotions, which can take all sorts of forms that may or may not be comfortable for people at first, but you teach them how to be with that and cope with that, so that if that stuff comes up during the letter to the inner child, that they have the tools to relate to it.
Exactly. And they are able to handle it and to let it go, to release it. And that feeling of releasing these unpleasant feelings is a very liberating and empowering feeling. Yeah. And
so it's not just, it's okay for me to feel my emotions. It's okay for me to have a cathartic emotional response and cry for 3 hours straight and shake and cry and come back and then cry more. Like they could really release. Does that happen sometimes?
Yeah, exactly. It's about releasing the emotions. Like emotional healing is just purely releasing the feelings. These emotions came into the person, and healing means, giving it back. So letting go of it, because emotions themselves like don't have to be healed, because the emotion is, it's obviously purposeful as it is. So emotional healing really just means letting go. And, that is the real goal of the inner child reparenting process, is just allowing the inner child to finally let go of the feelings that were linked to an unpleasant experience that they were stuck in.
Right. Very interesting.
Yeah. So
what comes up for me in connection with our previous conversation, we were talking about, there's the software and the hardware, right? And of course it's not an either or. The human being is an integral experience of mental, emotional, physical, spiritual. But, one of the most sort of obvious, well demonstrated, well accepted um, realms of interconnection of the emotional experience and the physical experience is this whole stress relaxation response and what we call the autonomic nervous system, which has this vagal response. And the vagal response is a relaxation response, and the sympathetic response is a stress response. Um, but it's well known that this feeling of that people get sometimes when there's a lot of emotional intensity, where they might sweat, they might feel nauseous, they might throw up, is
Yeah.
frequently, the system is in a sympathetic stress response and it's kind of held in a tension place. And when there's release, it's a massive vagal outflow. And that vagal outflow, first of all, dilates blood vessels and can create that sort of sweating, dizzy thing. And then the vagus is very much innervates all of the gastrointestinal organs. And when there's a big vagal outflow, a person can feel nauseous and throw up.
Yeah.
And so, it's sort of um, it's like a physiologic pattern that very much fits the sort of mental emotional experience you're describing of when somebody has a sort of persistent emotional distress um, pattern that suddenly releases through this exercise, and that stress pattern is replaced with a vagal release, and you know
Yeah.
they're they're on the
Wow,
floor
that's
sweating,
fascinating.
throwing up, maybe they're soiling themselves, but it's a therapeutic pattern.
Gas is common. Gas, hiccups.
Yeah, yeah,
I see that. I see hiccups. I see most of the times for a session, I'll say to the client, "Do you have a glass of water?" And they're like, "No, no, I'm fine." I'm like, "No, no, get a glass of water." Because when the emotions come up, the emotions sit here, and the
yeah.
client will start coughing. Then they're like, "Oh, I've got a tickle in my throat." I said, "See, I told you to get a glass of water." But gas, hiccups, burping. I have clients also that start burping in a session sometimes when the emotions start to come up a little bit.
Yeah.
Yeah, nausea, back pain, different things. And I'm super fascinated, even about just a little bit that you've spoken tonight about the different, I guess, anatomies and the different physiological things that are happening. So in our next session, Doctor, I'm definitely going to pick your brains about the physiology side of things, and also what type of like hands-on or even like physical approaches are available for what we're talking about. I'm super interested in that.
Sure. Yeah, it's good stuff.
Yeah. So I'm gonna
Yeah, I
I'm
mean,
gonna get I'm gonna get you on that.
yeah, I hope so. It's good. I love to talk about it.
Yeah.
The hiccuping thing is big, right? I've definitely heard that from a number of situations, especially when people have been working through traumatic memories and experiences. And at a certain point, they'll get just like attacks of hiccups that could last 5 minutes or 4
Yeah.
hours. And, the way part of how I understand that is that the diaphragm, like what is a hiccup? It's a spasm in the diaphragm. The diaphragm is this, if you looked at my body from the side, it's a dome, and the diaphragm pulls down when you breathe. It contracts and draws air into the lungs, and it relaxes and the air moves out of the lungs. And a hiccup is like a diaphragmatic spasm or release. And I'm actually not sure if it's a spasm or release, or it could be both. The point is, it kind of gets a little unstable, and it instead of it goes.
Yep.
Um, and so the fear response as it reflects in our breathing or patterns of breathing. So for instance, like somebody gets scared and they go and they sort of hold their breath, and there's a sort of bracing pattern for the whole body, but especially the diaphragm, and it's a fear response of holding the diaphragm. And so, I've not seen any research or data or talking about this, but just on a phenomenologic level, thinking about someone who's had traumatic experiences where there was a sense of like maybe repeatedly or maybe intensely. And then at a certain point, they start to meet themselves in those memories or in those mental emotional patterns associated with that trauma and fear. And it could just kind of reawaken that, and they could start hiccuping for a while. And it sounds like you've seen that
Yeah.
happen with people.
Yeah. I see that a bunch. Yeah. I see that a lot of times. And yeah, that's a very well-informed explanation of that, I would say.
Yeah.
Yeah.
Yeah. So, yeah, great. So Josh, you're bringing up this notion of, okay, what are the sort of physical, structural, mechanical things working through the movement system of the body that can be relevant to trauma, to emotional distress, to all that kind of stuff. And that's a really rich topic for me, because part of what I love doing is teaching people embodiment, and teaching embodiment through breath work, through meditation, and through movement. And there's a number of things that people describe coming out of that. From the way I understand it, is it's about bringing consciousness into the body. It's bringing awareness into the body. And that itself can be calming, because maybe, and I'd love to hear if you have something to say about this, but frequently the kind of the anxious, depressed mind and emotional state is kind of, the heart upward, right? There's an emotion, there's various thought patterns that are sort of reinforcing and interacting with that emotion, but it's kind of like a cycle of thought, emotion, thought, emotion, thought, emotion, thought, emotion. And what we're doing in embodiment practices and disciplines is bringing that awareness into the body. We're grounding it in the physical sense of self that is on the ground. And we do exercises that are about feeling the connection to the ground, feeling a connection to the breathing. And that itself can be so calming, and brings insight, because suddenly the person's got like a stable place where their awareness is located. And from that stable place, they start to notice, well, here's what's coming up in my emotions and in my heart and in my mind. And they start to see it, and then they can start to dialogue more effectively with it, like you were describing in some of the exercises that you're talking about. And the other piece, which I think is really fascinating, and it's a fairly new area of inquiry, is that, your movement parts of your movement system is very complicated. You got this big, like, cerebellum, which means like little cerebrum. It's like, it's not your cerebral cortex where you think, it's your cerebellum, and it's where you move. And all of your movement centers are coordinated right there in your cerebellum, with different parts of the midbrain and the spinal cord and the body. And you've got a map of your entire body in your brain. And that cerebellum, which for, forever until the last couple of decades, we thought was just involved in coordinating movement, turns out your cerebellum is profoundly integrated with the emotional centers of the brain. And so one level of that is that people can have memories that are very anatomically specifically associated. And there's a whole realm out there in the world of body work that people want to say, it's the memory in your muscles, which I think is kind of oversimplifying it and narrowing it, because you know what? The muscles are in relationship with the nerves and the spinal cord and the basal ganglia and the cerebellum and even the higher cognitive centers. So it's complex, integrative physiology. But the point is, like, I've got dozens of case examples and experiences where a person was dealing with persistent, horrible pain without any kind of clear, kind of conventional anatomic findings on their scans or tests or whatever. But when they got into a bodywork movement therapeutic mode that brought them into certain positions, then there was a spontaneous arousal of certain emotional patterns that were traumatic and could then be healed and released. And then, gosh, guess what? The pain went away.
Wow, that's fascinating.
Yeah. So it's a whole world of understanding that I think, since modern medicine is starting to develop functional MRI scans that can look at the brain's activity in real time, we're starting to see insight in how all these areas of connectivity in the brain can sort of explain and help us understand and work more effectively with the integration of mind, emotion, and body.
Wow. Yeah, that's fascinating stuff. That is, like, obviously very cutting edge stuff. And so, like, is this something that, people that you're teaching people in your workshops and the work that you do?
Sure. Yeah. Well, so, the thing that I'm most excited about is that I teach movement arts. It's mindful movement. And I teach it in the context of a program called Movement Towards Health. And Movement Towards Health is really about learning a number of different mind-body skills of quieting the mind, coming to the breathing, body awareness, and then movement. That's mindful movement. And, you know, years, decades ago, I studied things like yoga and Tai Chi and movement arts that are really about integrating consciousness with the body. And then I kind of worked that through exercise science and physiology and rehabilitation, and then studied osteopathy for a couple of decades, which is also about integrating these things. And so what we do in Movement Towards Health is we do various movement patterns with breathing, with calming. And it's really about bringing a calm mind to movement in the body. So, you know, there's been research showing that, you know, there's a spectrum, first of all, of meditation that's a physical meditation and meditation that's just a contemplative mental meditation. And some people prefer the contemplative, that they're more maybe intellectually focused or anchored. And some people are more connected with the sort of embodied meditation and movement. And so it basically provides that channel of calming and re-regulating the central nervous system for people who have anxiety or depression, who are body-centered people. And it's a very gentle movement that anyone can do. And that's part of where it also potentially serves people who have pain or fatigue, who might not be able to participate in normal standard physical training or physical therapy because it either flares up their pain or flares up their fatigue. But meanwhile, it's this calming, gentle movement in these patterns that unwinds the tissue and unwinds the fascia, frees up the joints, frees up the body just to function better. So I'm excited about that. And we're getting ready to relaunch that in August. So,
wow, that sounds fascinating. That sounds great.
Yeah, cool. Thank you. Thanks for asking. Okay, great. Josh Goldberg, CBT practitioner. Thank you so much for joining me. Thanks for sharing all this really interesting information about how you help people heal from trauma, improve their relationships, kind of reparent the inner child and release those difficult, painful patterns. Such synergy with the kind of work that many of us are doing who are more somatically oriented towards physical pain, emotional pain. So it's really a pleasure and a privilege to have you here. Thank you.
Thanks so much for having me on. I'm very much excited to have you back on the channel and talking about the different modes of work that you do also. Thank you.
Great. All the best.